Well, good morning, everyone, and hope you're having a great start to your day here. And as you get your notifications, let's say hello to Brahim, numero uno, this morning, Andrea, Niagara Falls, and Mike from There you are, Mike. We missed you this week. Good to have you on from Norland. And Brahim says he loves everybody. We love you too, Brahim. Jude, Troy, New York, Oshawa, Kevin, Cheryl, good morning. Nick from our staff, good morning. Betty Lynn from Brantford. Carrie from Nebraska, good morning. Joanne from Berks Falls. And Little Britain, who was that? Oh, it's going up into the clouds. I can't see them. Nellie, how are you? David from Ridgeway. Let me see if I move this a little bit. Rose, Kim, Marilyn. I'm going to bring it over here. Fran from Orangeville. Doug from Douglas, how are you? And Karen, Deb from Motown. Donna, how are you? Jeanette from our staff. Good morning, Jeanette. You loud? Good morning. Johanne, how are you? And who's from Gilmore? See, goes into the clouds. I can't see it. Donna from Park Hill. Frida, Devlin. Cecilia, Shediac, New Brunswick. Rosalinda saying hello from the kidneys of Canada. Maria and Yvonne Petawawa, good morning. And Leslie, Thunder Bay. Margaret from Lakelet. Diane, LaSalle. Jean, Peterborough, good morning. And Laurie, Cambridge. Mary, New Brunswick. Samuel, Marilyn from Edmonton. Carol, Dave, I can't see that. Andrea, I already said hello to you, didn't I, Andrea? Sue, good morning. Couple more, guys. Sandra, we got a lot of questions. Aurelia, and who was that from Doketown, New Brunswick? Judy, how are you? Leela from Verner, good morning. And I can't see it. Guys, it goes up into those clouds. Francis from Vaughan. And I can't make it out. Denise. Guys, thank you. Okay? Okay, let's get going, guys. We love you dearly. Okay, here we go. Let's get to these questions. And I hate to miss any of you. Okay, there's a lot of questions about hormones and HRT, which is hormone replacement therapy. We'll answer these as many as we can. Okay, Gail talks about, do I believe in wild yam cream? Yeah, I do. Not the best though. Okay. So again, you know how I put things into perspective. You have good, you have better, and you have best. Okay? Good, better, and best. The best is what they call bioidentical hormones. Okay? Now, a bioidentical hormone comes from wild yam. Okay? But to get a bioidentical hormone, it must be compounded by a compound pharmacist. Okay? And so even though it's a derivative of wild yam, it's better because it's completely identical to your hormones. And here's my overarching principle. Okay? Here's my overarching principle. When it comes to estrogen, makes you a woman, progesterone, pro-babies. Okay? That's what that means, progesterone. You want a balance between the two. Somebody asked, okay, so this is Gail, okay? Robin is asking, I really struggle with potential side effects of estrogen, and I'm finishing your question, Robin. I really struggle with the potential side effects of estrogen therapy. Right? I think you're asking that. Is vaginal atrophy not a sign of estrogen dominance? No. It's usually a sign of your estrogen going down. Okay? Okay? Or low progesterone. Yes. You see, the reason I don't like estrogen therapy, okay? I think I've explained this many times, but it's worth repeating. We live in a world that is estrogen crazy. Every chemical known to man just about increases estrogen. Now, when you're in menopause or perimenopausal or whatever, of course your estrogen is coming down. It's normal. But the key to that is its relationship to progesterone. Okay? Progesterone. And that's why I don't like estrogen therapy per se. Okay? And I never used it in my office, in my practice days. I didn't like using estrogen. I know many doctors did. They used synthetic estrogen, which usually came from horse's urine. I never liked that. And, the birth control pill, horse's urine. That's how they make it. And you're not a horse. You're a woman. I never liked that. Now, you can do a bioidentical estrogen therapy. Okay? Again, I don't like it. I would prefer a bioidentical progesterone. Okay? And when you look at our menopausal formula, it blocks extra estrogen. That's why we put the DIM in there. And we elevate the body's natural progesterone. Okay, so that's the way I operate. And I love the questions because Robin is saying, I really struggle with the potential side effects of estrogen. Yeah, me too. I don't like it. I don't like estrogen therapy because estrogen is a growth hormone. And you got to be careful. And someone else is asking this. Let me just get to it so I can answer it at the same time. Okay, anonymous. They want to put their name. I know Dr. Martin is against oral estrogen HRT. Okay? But what are his thoughts on vaginal estrogen? I don't like it. I don't like it. I'd rather you use, if you're going to use a bioidentical, I would use progesterone. It's safe. Okay? It's safe. I don't like estrogen therapy. I really don't. And that has been my experience. Let me see if there was someone else. Okay, Kim is asking, is Dr. Martin against HRT, hormone replacement therapy? Well, I'm not against bioidentical. I don't like HRT, which is hormone, because they're using synthetic hormones. Kim, I don't like that. Okay? So you're asking me my opinion. I was a hormone doctor. Like I saw tens of thousands of patients and women struggling to balance their hormones. Okay? And when you're dealing with hormones, you better, number one, be a good listener. And you better get results. Okay? So that's me. Okay? I think I answered everything about HRT and bioidenticals. And so I'm not against wild yam cream. I just didn't find it to be all that effective. Okay? Some people liked it. It was good, but it's not the best. Okay? It's not the best. Okay, Cecilia, how are you? I have a cataract in one eye and the start of macular degeneration in the other eye. I also take 4 DHA and 4 Navitol every day. Good for you, and keep it up. You're doing the right thing. And, again, Cecilia, okay? Here, when we talk about macular degeneration and we talk about cataracts, what are we talking about? Blood supply. Blood supply. The eye, it's all about blood. The kidneys, it's all about blood. Circulation. Now, you don't see it in your eyes, but when you look in the back of your eye, when an optometrist has a look in there, or an ophthalmologist, or your family doctor, whatever, I used to look at eyes all the time. It was amazing. It's all the blood vessels. And that when that gets compromised is when you get macular degeneration or cataracts, glaucoma, diabetic retinopathy. It all has to do with circulation, so you're doing the right thing. The best thing for circulation behind the eye, the best, is high DHA, Navitol, which is elevates your nitric oxide, is a powerful, nitric oxide opens your blood vessels. Very good for microcirculation. And the other one is watch your sugars, because sugar, there's nothing that sugar will destroy faster than capillaries and blood supply. So you're doing everything, Cecilia. Good for you. If I was you and you already had this macular degeneration, is you can still prevent it. You have a cataract, and maybe up your dosage a little bit, just for you, Cecilia. You're already taking a good dosage. Okay? You already are. Therapeutically, you're taking very good dose. If I was you, I would up it even more. Go 2 more Navitol and 2 more DHA. That's what I would do if I got that diagnosis. You obviously have some advanced issues in your eyes, and you will do well by doing that. And you're already doing it. I would just, for you individually, Cecilia, I would increase it. Okay. Andrew, I am doing another reset. Well, you're a smart cookie, Andrew. And I told you what my grandson says, eh? Grandpa, I'm doing EMC, eggs, meat, and cookies. I'm doing another reset. Wondering about L-theanine. Okay, how can I get it? Well, if you take our cortisol formula, you can get L-theanine in there. But I'm wondering why you're asking about that, because L-theanine, I like it. Okay? But it's not an essential amino acid. Okay? It's not like your body makes it. And it's not I like L-theanine for a calming effect. Okay? I like it, obviously, because I put it in our cortisol formula. It's one of the ingredients in there. But I'm just wondering, Andrew, why you're asking in that sense. If you got any stress or whatever, I like L-theanine. You can get it in a small extent by drinking green tea. Now, why would you drink tea when you could have coffee? I don't understand that. But anyway, no, you're asking. But I'd like to know why you're asking that. Like, it's not an essential amino acid. You don't need L-theanine to be healthy. You need steak, which gives you all your amino acids, essential ones. But I like L-theanine, so don't get me wrong, Andrew. I'd like to know why you're asking that. Okay? Okay, Lise, what about your advice on small vessel disease in the brain? Well, small vessel is a name for one of the forms of Alzheimer's. Okay? Dementia, I mean. Okay? You have Alzheimer's. You got Lewy bodies. You've got small vessel. And small vessel is a vascular thing. So, you know what I talked about in your eye? Well, your brain too. And what they call small vessel is a blood supply issue. Okay? So, I'm talking about, this is one of the reasons. One, get your sugar down. Remember what they call Alzheimer's. Type 3 diabetes. Okay? Secondly, increase the blood supply to your brain. Exercise, vitamin E, get your good sleep. Sleep is so important for the brain. Why? Because when you sleep, your brain has a self-cleaning oven. When you're sleeping, your brain gets rid of all the waste material, all the junk, all the garbage, all the dead cells. Okay? So at the end of the day, that helps even in small vessel dementia. Blood supply. Increase your nitric oxide. Increase the opening of your blood vessels. Okay? Think of nitroglycerin, nitric oxide. In 1980, I didn't even learn this in school. Okay? We knew about nitroglycerin. They would give for angina, but we didn't know how it worked. All we can think of is an explosion. Okay? Nitroglycerin. They actually give it. Today they would do it probably in patches or sprays for people that have angina. But even in the small blood vessel, you want nitric oxide. Nitric oxide, vitamin D. When you get in the sun, you're elevating your nitric oxide. It's one of the big benefits of sun, steak, and steel. Get strong. Vitamin E. Exercise. One of the best things you can do for small vessel to prevent small vessel dementia. Okay? Nitric oxide, high DHA. What does DHA do, by the way? Your brain's made up of DHA. You got fat in your brain. You're a fathead. And you want to always be replacing the DHA in your brain. That's why I talk about DHA. It doesn't mean EPA is no good. Okay? It doesn't mean that. What it means, though, is DHA is the primary omega-3 that you want for your brain, for your blood vessels. It lubricates. You're getting an oil change. It makes your blood vessels even more slippery. You don't want them to be sticky. You want them to be slippery. I used to say it on my radio station, radio show. Take enough oil so that you slide out of rooms. You're so slippery, Lubricate those blood vessels. Lay off the sugar, vitamin D, DHA. I love Navitol for increasing nitric oxide. Navitol crosses the blood-brain barrier, which is pine bark extract. It crosses. It's so good for the brain. This is what I do. This is what I do. Very, very good questions. And hold on a minute, Sue. I take 4 drops of oil of oregano every day. Yeah, me too. 3 probiotics. Me too. And the reset diet. Me too. And wondering what else I can do for my leaky gut. No, you're doing it. And Sue, how long will it take to heal up? Well, first of all, Sue, if you were live with me, I could ask you a few questions, So, how do you know you have leaky gut? Now, we talked about it. We went through leaky gut, leaky brain this week. Spent a lot of time on leaky gut. Leaky gut starts with a dysbiosis, an imbalance of your bacteria. So when you're taking broad-spectrum probiotics, you're actually healing that, And the other thing that people don't realize too, by the way, one of the things that sort of knits your barrier between your blood and your gut, we call the gut-blood barrier, is quercetin. So what is quercetin? It's the color of all the fruits and vegetables. Those colors. And quercetin is a supplement with that, and those things help knit that blood gut barrier. So I'm just assuming, Sue, that you got diagnosed with leaky gut, and maybe only because remember now, a lot of people have no digestive issues at all and have leaky gut, because it's usually manifested and a lot of times in a different area. Leaky gut, leaky brain. Leaky gut, leaky skin. So if you got skin problems, a dermatitis or a fungus, or you have any kind of fungal or whatever on the skin, acne, you got leaky gut. Leaky gut, leaky skin. So if your skin clears up, you know you've cleared up leaky gut. And leaky lungs, leaky sinuses. So it depends, Sue, how long it takes to heal up. I've seen people take them a couple of years to completely heal a leaky gut. But you're on the right track. You're doing the right things. So again, you might have some digestive issues too, Sue, with that. And you're doing everything. And really watch your carbohydrates and your simple sugars. And because it feeds the bears. With leaky gut, you get the Trojan horse coming in. You get yeast. You get candida. It now leaks into your bloodstream. And you want to make sure you don't feed the bears. And probiotics, especially with L-rhamnosus and L-reuteri, which is part of our broad-spectrum probiotic, it kills yeast. I love what you're doing. Okay, I really do. Okay, that was Sue. Rafaela, how are you? Urea plasma. Okay, I haven't heard that in a long time. I'd like to ask Martin if he would consider the treatment for urea plasma with antibiotics. Well, look, a lot of people have that bacteria in their body. Okay? It can be transmitted, it can be transmitted sexually, but it's not really an STD, okay? And here's me, okay, that's why I never talk about it, because I'm not too worried about it. Like, if you take, Rafaela, if you are on a broad spectrum probiotic, that bacteria, okay, will stay at bay. And you won't even know you have it for most people, okay? Because your body's immune system, you're so fearfully and wonderfully made. You're made to fight. You're always going to be surrounded by bacteria, okay? Always. But if you have more good guys than bad guys, it's called you win. And don't feed the bad guys, because bad bacteria live on junk. They love something quick and simple. Simple sugars, simple flours, and junk. So don't eat junk. Oil of oregano. Very, very, very powerful natural antibiotic, powerful natural antiviral, natural antifungal. It's why I talk about it all the time, because I find it to be so effective. And one thing about oil of oregano, you can take it every day. It's so good for you. It's a spice. It's so good, and it only focuses on bad guys, not your good guys. Well, it actually empowers your good guys. Okay? So, I haven't been sexually active for the past 3 years and had no other type of contact. Yeah, but you can have that. And I wouldn't take an antibiotic for it. That's me, okay? And you know, I love antibiotics. I do. But if it's not bothering you, I would not do that. I wouldn't do it. I'd use probiotics and oil of oregano. And Debbie, what are my views on Earth's mushrooms and L-tyrosine? Well, I like L-tyrosine. I have it in my... Okay, one was L-theanine that someone who was asking again, Andrew was asking about. And Debbie's asking about L-tyrosine, which I put in our thyroid formula. Okay? If you haven't seen our thyroid formula, like there's nothing better, in my opinion, that you can take. Any kind of sluggish thyroid at all. Or even with hyperthyroidism, because somebody asked me about that. I'll talk about that in a minute. Okay? Earth's mushrooms, I like them. I love mushrooms. They're good for you. Very anti-cancer, very powerful antioxidants. They're really good. Earth's mushrooms are fantastic. Now, Earth's, I think, is a kind of mushroom. I like them. I like mushrooms. I put them on my steak. Okay. And I guess earth mushrooms for sleep and increased mood. I don't know about that, Debbie. Okay? Maybe they're good for that. I don't particularly use them for that. But hey, I got no problem with it. But the L-tyrosine, yeah, absolutely is good. Good for mood, good for sleep, helps to balance the thyroid out. Okay, Judy, hold on. Let me just see if I can get something on. Might as well answer this. Okay, Monica, lots of speaking on hypothyroid. Well, that's the majority of cases, Monica, okay? And if you have a hyperthyroid, okay, not hypo, but hyper, your thyroid, you usually have almost invariably autoimmune disorder. So you got to start in the gut because that's where it started. You have to start in the gut with, and that can be Graves, right? Graves' disease, which is hyperthyroid. And the eyes bulge out, swollen, usually thyroid, rapid heart rate, weight loss. It's the opposite of the hypo, but you know what? The disorder, though, is usually from the same origin. And hypo can go to hyper. It's autoimmune and you start in the gut. Every autoimmune disorder starts in the gut. Leaky gut, leaky thyroid. Fix the gut. I love the reset. I would be on our thyroid formula. I know they say don't take any iodine, but when you have iodine I never liked iodine on its own. I like iodine with selenium. I like iodine with L-tyrosine. It helps to balance, whether it's high or whether it's low thyroid functioning, it helps to balance it out. Okay? Okay, thank you for the question, Monica, because I do speak about the sluggish thyroid much more, but that's just because it's more common. Okay, let's get to Tina's question. Okay, I think we're at, Judy. What are my thoughts on electrolytes? I like electrolytes. You need electrolytes. Now look, some people get away with making your water a little bit salty. Okay? And I like a Himalayan salt or a Celtic salt, a good salt. Okay? And the reason I like it is because then you have electrolytes. I like electrolyte water, spring water. It has electrolytes in it. Now, some people need more than that. Okay? Some people need more electrolytes than others. They sweat more for whatever reason. They lose more electrolytes. And a pinch of salt is not enough for them. And they take electrolyte powders, whatever. Do I like that? Yeah, if you need them. I got no problem with that. Okay? I got no problem with taking electrolyte powder. Listen, I tasted, okay? This is how old I am. I tasted the original Gatorade made up of, or it came out of the the Florida Gators football team. And there were scientists there and they developed a drink. Can you imagine? They were in training camp, the Florida Gators, in August in Florida. And they were dropping like flies, sweating so much. And so they developed, and they used mostly just potassium as an electrolyte. And it tasted like urine. It was terrible tasting stuff, but it worked. Okay? And then, the big food companies got a hold of it and they turned it into Gatorade. And now you got Gatorade and Powerade. I don't like those. Okay? I really don't. And, but they do have some electrolytes in them. And you can get, there's so many electrolytes now, companies, okay, in powdered form you can add to your water. I got no problem with that at all, okay? So if you need electrolytes, extra electrolytes, then certainly take them. Like magnesium is an electrolyte. I take magnesium separately, okay? I take magnesium separately. But magnesium is an electrolyte, okay? Calcium, sodium are electrolytes, okay? Potassium, chloride, okay? Tina, Dr. Martin, I listened to a previous podcast on your answering for creepy, or do you say creepy or crappy skin? I don't know. Have you learned anything else? I don't know. I'm always learning. What did I say in that podcast? I must have talked about leaky gut. No, here, let me give you one. I don't know if I talked about this or not. I should have if I didn't. When you get a creepy skin, that's like, okay, I don't know. I don't want to say wrinkles only. It's, I got a little bit of it, okay, as I aged. Generally, I get good skin, but a little bit of creepy skin. I noticed that when I, let's see if I can show it to you here in my muscle. Okay, do you want to see my muscles? There's a little bit of, and the best thing for that, and I find a big difference on that, is collagen, bone broth, collagen protein. That's what bone broth is. Somebody was asking this morning, I want to take, can I take bone broth as a protein powder? Absolutely. It's the best in the world. Collagen protein is the best. And collagen is what is missing in your skin. And look, collagen is like your matrix of your skeletal system. And when your skin loses some elasticity and you get some creepy, I don't even know how you want to say it, skin, I like collagen for that. Collagen is fantastic, and bone broth is collagen protein. So make bone broth, and if you don't make it yourself, we provide it. It's one of our most popular products, is our bone broth. Okay? I use it all the time. It's good for you. Good for your skin. Good for your bones. Good for your gut. Because of L-glutamine. Okay, a couple more here. Lucinda. What is protate magnesium? I've never heard of it. Okay? Now, I've heard of orate magnesium. Magnesium orate. There's all sorts of forms of magnesium. I just never seen protate magnesium. I like I said, there's magnesium, like we love biglycinate. We love the chelated, our magnesiums are chelated, meaning that they're already broken down. So is orotate. I don't know. I mean, I think you mean orotate. You know what? It's good. I got no problem with it because it's already chelated, meaning it's already to be absorbed in the body. Okay? So, like a citrate, whenever you see the word ATE at the end, biglycinate, they've been chelated. They're ready for absorption in the body. Okay? I don't like magnesium oxide unless you're using that just on your skin. But I honestly, and maybe you could show me, Lucinda, the protate. Is that a new one? Maybe it is. I haven't seen it. Show it to me. Okay, I just never used it and never even heard of it before. And am I learning all the time? Yeah, I'm open. Show me. I'll tell you what I think of it if you show me what it is. Okay? Okay, because I think it's an orotate, but maybe I'm wrong and you're right, and I don't know. Okay, one more. Let's, Louise, what is the cause of peritonsillar? Well, look, peri means on the side of your tonsils. So peritonsillar what? Are you talking about an abscess? Are you talking about an infection? Are you talking about what on peritonsillar? Peritonsillar just means besides your tonsils. So be more specific, Louise. What is the cause of peritonsillar what? Abscess? Okay? Well, usually a bacteria. Usually it's a bacteria. Could be fungal. That's why I'm big on oil of oregano. I love oil of oregano. Orally, fantastic. That's why I like broad spectrum probiotics, because certain strains will go to different places. Okay? Different tribes of bacteria do different things. I call them tribes, they're strains. Okay? That's why when you get a broad spectrum, you get coverage from your brain to your toes. Okay? Okay, let's drop it there. And then we'll answer. Okay, let me just see how many more we have. Okay, why don't we just finish these up? We're almost done. Nancy, if your cholesterol is high, which is what we want, you got it, Nancy, okay? Is there a concern if one or both of your parents passed away from heart attack? Well, again, okay, Nancy, you can't ever get me concerned about high cholesterol, your total cholesterol or whatever. If your parents passed away from heart disease, it wasn't because they had high cholesterol. I know that's what medicine thinks, but they didn't die of high cholesterol. They didn't get a heart attack because of high cholesterol. They might have got a heart attack because they had low cholesterol. Okay? Cholesterol is not the boogeyman. You just can't make it a boogeyman because it's not. Your body needs cholesterol. And I don't care if it's LDL or HDL, your body needs it. If you want to insist on having low cholesterol, you're going to die younger. That's just a fact. Because your body needs it. Your brain needs it. Cholesterol, every cell in your body's got cholesterol. So, now, if you got some genetics for heart disease, okay, that's a concern. But genetics make up 5% or less. You can override your genetics. See this face? Diabetes written all over it. I look in the mirror, I see my father, diabetic. My grandfather, diabetic. It's in my family. I don't try and fool myself. I know genetically, okay, I'm even more susceptible to diabetes. I have to be careful. Me and carbs don't get along. I love them, but they don't love me. Okay? And heart disease, I've taught you this many a time, okay, is atherosclerosis, hardening of the arteries. And go back and listen to our podcast on hardening of the arteries, what to do to avoid it. And get your triglycerides down by cutting out your sugars and cutting down on your carbohydrates. Okay? And I love protecting your blood vessels. That's why I love high DHA, lubricate. That's why I love the Navitol, That's why I love CoQ10, ubiquinol, okay, for heart. Anyway, thanks for the question, Monica, okay? Susan, what are the symptoms of polycythemia vera, which is a blood cancer? You're making too many red blood cells out of your bone marrow. Symptoms? Probably mostly fatigue. And it's a rare type of cancer in the bone marrow. A lot of doctors, what they do is they watch it because it can be slow, not an aggressive cancer, and they usually, they'll take blood out of you. They'll take blood out of you to lower the amount of red count. Okay, Lee's, my friend has osteophytes. Well, your friend and many millions of people have osteophytes. Those are just anchors. It's the bone. Okay, you can get osteophytes in any joint, in your spine, where they just sort of anchor down. The body is so smart, because if you have an injury or chronic inflammation there, the body often will anchor the joint so you can't move it as much. Osteophytes, okay? I've seen thousands of them on X-ray, okay? Osteophytes. And what can she take? Well, keep moving. You might not get rid of an osteophyte, okay? But that's all right. You can live with them. Get strong. Get your muscles strong. It's one of the best things you can do for bone, for joints. Move and don't stop. And you might, if they're in your knee, for example, you got degeneration there and osteophytes in your knee. Like I said, bike. Instead of running. It depends on whether you have pain. A lot of people have osteophytes. They have no pain whatsoever. The only reason they know is because they see it on X-ray. Okay? And again, I've seen a lot of that. Lots and lots of that. And Faye, will the new multi-nutrient break a fast? Well, technically, yes. But in reality, no. Okay? I don't like, because people, Doc, I'm fasting. Good for you. But can I have a coffee in the morning and I put a little bit of cream in it? Yeah, you can do that. Am I breaking a fast? Technically, yes, but in reality, no. Because the reason that I love fasting more than anything else is because you're not using your pancreas. You're not using insulin. So when you take the multi-nutrient, you might be technically breaking a fast, but in reality you're not, because you're not using any insulin. And I know some people are purists. I mean, nope, I'm not having anything, just water. You mean you're not having a coffee? Well, you can have a black coffee, by the way. It won't break your fast. But anything like that, you take a supplement, you take your DHA in the morning, are you breaking your fast? Technically, yes. In reality, no. You're not. Because you're not using insulin. That's the key to fasting. Okay? And I know there's phagocytosis and other things. They still occur. Okay? So, anyway, thank you. Last question. Andrea, my husband and I have been doing EMC with a low-carb fruit, veggies for 2 years. Very smart. Okay? My A1C is 6.0, and you're weird, Andrea. No, you're unique. I thought I answered this question. Maybe I didn't. Andrea, you're unique. Most people, their A1C go way down. You're eating the right way. You might just a little bit less fruits and vegetables, okay? Maybe for you, Andrea, you got to be even more strict. But, listen, are you feeling good? Yeah. You're doing well? Yeah. Look, I love numbers, okay? So don't get me wrong. You know me and A1C. I love A1C. But it isn't the be-all and end-all. Everybody's different. You got a different fingerprint, okay? That makes you unique, Andrea. Sort of look at yourself in the mirror and go, hey, I'm me. Nobody else is me. And if you're doing well, and get me your triglycerides, get me your HDL, and if your A1C is a little high, well, you and carbs don't get along for sure. Okay? You just don't get along. So maybe you got to cut back a bit. But if you're doing well, and I like the way you're eating, it's just the way you're built, probably, Andrea. It's just the way you're built. I wouldn't worry about it too much if you're doing well. Give me your other numbers so I can give you a little bit better of an answer. Okay? Okay. Hey, guys. Hey. Went a little bit extra this morning, but we got all the questions. We love you guys. Sincerely and dearly. Thanks to my audience. You guys are fantastic. Talk to you soon.